Today I want to talk to you about pulmonary edema. A 55-year-old male was brought to the ER this morning by ambulance because he had significant shortness of breath at home, and so his wife called 911. On arrival, he was severely diaphoretic, struggling to breathe with frothy pink sputum. I have a doctor with me. Together we will manage the patient. Doctor, how do you want to initiate care for this patient?
First, I want to make sure he is connected to the cardiac monitor with oxygen, IV access, and an EKG.
That's a good start. He's being monitored, oxygen in progress, and IV access attained. The ECG does not show any ST or T wave changes. His blood pressure is high and he's tachycardic. Are you concerned about this?
Yes, I am concerned, but I would like to know a little more about him. Does he have any medical problems I need to know about?
Yes, he does. His wife states he has hypertension, diabetes, and congestive heart failure. No renal issues as yet. He is on carbidopa, ACE inhibitor, and Lasix, but seem to be non-compliant. What do you want to do for him now?
Well, I want to do a quick physical exam. I will start with his vitals. He is tachycardic and his blood pressure is high. His airway is patent because his chest is rising with each struggling breath, and his wife did not report any trauma. He is extremely diaphoretic and his jugular veins are distended. There is bilateral air entry with significant bilateral rales. His abdomen is soft with bowel sounds in all four quadrants. There is bilateral leg edema, the skin warm to touch, peripheral pulses are present, and he is moving all four extremities.
Look how frothy and pink his sputum is. Does that alert you to anything in particular? Order a chest x-ray, labs including troponin and BNP.
Yes, it does. I am thinking of pulmonary edema.
That's correct. Usually these patients present with symptoms of left ventricular failure, severe respiratory distress, and pink frothy sputum. Auscultation of the heart usually reveals bilateral rolls and a third or fourth heart sound. Doctor, your patient is still struggling to breathe. What do you want to do now?
I think I will put him on BiPAP. In his case, he remains hypoxic in spite of oxygen therapy. Plus, he is alert and able to cooperate. If he were unconscious or appears to be tiring rapidly, then I would consider intubation.
Now your patient is on BiPAP. What medication do you want to give him?
I will give him nitroglycerin 0.4 milligrams sublingually. I will repeat this every 5 minutes if needed. If after 3 doses without response, then I would consider a nitroglycerin drip 0.4 micrograms per kilogram per minute. I would titrate this to his blood pressure and symptom reduction. Along with the sublingual nitrate, I would also add furosemide 80 milligrams intravenously.
What should you be concerned about with both nitroglycerin and furosemide?
Apart from the patient improving, I will look out for hypotension and hypokalemia.
That's correct. Nitroglycerin is a vasodilator and can significantly decrease preload, thereby dropping the blood pressure. Furosemide decreases the volume status, which can also lower blood pressure, but more concerning, it lowers potassium level. Your patient seemed to have improved with BiPAP and medication. What do you want to do now?
I want to review his labs and a chest x-ray. The troponin is negative, but the BNP is over 2000. The chest x-ray shows classic cephalization and fluffy infiltrate, giving the batwing effect.
How many types of pulmonary edema should you be aware of?
2 types, cardiogenic and non-cardiogenic. Cardiogenic is due to left ventricular failure, while non-cardiogenic originates in the lungs.
Do you know what causes pink sputum?
Yes, destruction of pulmonary capillaries and seeping of plasma into the alveoli.
Remember, in patients with pulmonary edema, acute MI has to be ruled out. Troponin and ECG must be ordered. Good job, doctor. You saved another life. Remember, BiPAP over intubation where possible and sooner than later. Get the nitrates and diuretics on board and monitor blood pressure and the potassium level. Symptoms usually improve with the appropriate medication and intervention. Well, thanks for watching. Don't forget to like, share, and subscribe. I wish you well. Good night.